Lisa, you all right?
Yes, thank you.
Obviously, as you know, I'm the brand and strategic partners lead at Hallam Medical, and I've been working at Hallam Medical for 6 years. And today we are obviously launching the first Chief Nurse podcast. Are you excited?
Very excited, Charlotte.
Me too, me too. So let's kick off with you introducing yourself and just talking a bit about yourself before joining Hallam Medical.
So my name's Lisa Locker and I'm Chief Nurse at Hallam Medical. I qualified as a nurse in 1991, which makes me sound ancient saying that. Did lots of different areas of nursing, then became an advanced nurse practitioner in 2008. And then went on to be a matron, and my last job was deputy nurse director of one of the country's largest teaching hospitals.
Oh, amazing. And obviously you worked as an advanced nurse practitioner, that's correct, isn't it?
And I still do a shift a month as an advanced nurse practitioner.
And in your role as an advanced nurse practitioner, you led quite a large team of nurses. How many was that again?
So in my job as an advanced nurse practitioner and deputy nurse director, it was 2,000 nurses. So quite a lot of nurses.
Yeah, a lot of nurses indeed. Obviously, you just manage me now.
Yeah, easy.
Let's get that one in. So obviously, as an advanced nurse practitioner and as a leader, obviously, what challenges did you face during, and do you think there's still those challenges out there now?
I think there were challenges, but I think the challenges are even greater now. I think we all know that the NHS is massively struggling at the minute, that whether that be financially or staffing or number of patients waiting. I think the NHS was already quite stretched, and then COVID hit us. And the impact that that's left on the NHS for waiting lists, treatments, access to GPs. I think your list could go on. I think it's such a challenging time for patient care, both in acute trust but also in the community. I think as we get an older population, being able to deliver that care at home by the right person is really, really important. And that also helps us with avoidance of unnecessary admissions because we can't deliver that care at home. And I think I'd probably drive you mad, Charlotte, because I could sit here and talk about all the issues that there are in healthcare, but they are numerous and they are extremely challenging at the minute for both patients and the people delivering the care.
So obviously, it's such a obviously, as you know, as an advanced nurse practitioner, it's such a autonomous role as well, and obviously utilising your role out there in the community as well, which we know we spoke about, and obviously within hospital settings, etc. So yeah, it's really interesting to listen to the different kind of challenges and different settings and what's out there as well. As well, touching base on when you was leading a team, what would your feedback or recommendation be, or your guidance to those leaders out there? What advice would you give to them?
I think as an advanced nurse practitioner or advanced clinical practitioner, it is a very autonomous role. And I think out of the four pillars, we often struggle with leadership. And I
Yeah.
think because you're working autonomously, people think you're not leading, but it is a really important pillar of our practice because it shouldn't be seen as mutually exclusive. You should be able to be an advanced practitioner and a leader as well. And now we've got more advanced practitioners. People are leading teams, they're leading services, they're leading delivery. So you definitely are leading. And I think it's to have confidence in yourself as a leader, and not just being seen as a bit of I work on my own autonomously. You will be leading services and provisions for patients all of the time.
Yeah, amazing. So now moving on to obviously your role as chief nurse, I believe is it nearly 3 years you've joined Hallam? Or is it just over two now? It seems
Two,
ages to be fair.
two, 2 years. second
years.
anniversary just coming up.
Oh.
So I absolutely love my role at Hallam. I've been absolutely privileged to be offered the role. It was very much uncharted territory when I came. I didn't really know what I was going to be doing. The team didn't know what I was doing, and clinicians out there don't very often get to work with a staffing partner that has a chief nurse or that support for them.
100%.
So my role is exactly what it says. I am the clinical leadership within the business. I'm the clinical supervision for the clinicians out there when they need help or support. Because, as we said, it is very challenging, and we can often have very challenging days or shifts. I love to go out there and get hands on and work with our clinicians so I can see what they do every day, as well as work with our clients and understand their services really well. So we can make sure that the advanced practitioner or community nurse or whatever we are delivering is the fit for that service, so that it works for that service and those patients. I have the joyous job of dealing with complaints, as all senior clinicians do. And that for me is really important, that it's about the balance in there, that the clinician gets a voice, the patient gets a voice, and the service understand why the decision that was made was made. So that's quite a critical role, really.
Yeah.
And safeguarding. Obviously, I lead on safeguarding for the business as well, both internally and externally with our clinicians that see patients. And I think that my most important role actually is being here as a sound clinical voice for the
Yeah,
business.
100%. Yeah.
Um, People can come and ask me anything if they don't know. If I don't know, because I don't know everything, I will go and find out what the answer to that is. And if it's nice for our clients to have a clinical face to touch base with as well, and somebody they feel they can come to. Although Hallam is a very clinically run business, as we
Yeah.
know, but it's nice to have somebody at the forefront of the business that's a clinician that you can approach or touch base with. And most importantly, it's getting out there and supporting the clinicians, as I've said.
Yeah, I think obviously what we've known as well of, oh, obviously when we're leading on to our partners in a second, you work very close with me with our partnerships. Just having that clinical expertise, which we know, obviously our founder Alex Monroe's got, and our CEO Deborah McCain's got the clinical expertise, but you're still like seeing, you're still practicing, so you're still seeing those challenges out there. And I think it's such a positive effect on Hallam Medical and our clients and our clinicians to know that they can touch base with someone who understands the real pressures as well. So I think it's such a positive obviously you're such a positive member to the team, and I think it's been really good. I remember obviously when we first met, when you first joined Hallam, and I remember I was so scared. So like, oh my God, we've got a chief nurse in the business, and
Really
you're just
scary.
just a lovely person. But yeah, honestly, I think it's just such a fantastic experience working with you as well as my manager, and just the knowledge that you share. So yeah, you're such an asset to Hallam Medical. Rolling on to obviously what we've just spoke about, our partnerships. As you know, I'm the brand and partnership lead at Hallam Medical, so working with our partners, the Queen's Nurse Institute and their networks, the CN and ICB, our other partner, the Association of Advanced Practice Educators, and our most recent one, Urgent Health UK. So we work very, very closely with them, attending the networking sessions, their online sessions, their conferences, you name it. But I want to know, what is your favourite part of working with partnerships?
I think it's the exposure to different knowledge, different experiences. I think it's being able to point our clinicians in the right direction if they need
Yeah,
something and we feel our partnerships could help them. And it's supporting some great organisations, really. I think
yeah.
that's really, really invaluable because they all do great work.
100%. Obviously, knowing that those three partners that we work with, obviously in so different departments, and obviously the Queen's Nursing Institute focusing on the community in primary care. Then we've got advanced practice educators, obviously focusing on the advanced practice education centre. Then we've got urgent health care, obviously with the urgent care cares across the country. It's such a good broad partnership, and obviously I really enjoy working with you on those as well. So obviously, when you first joined, you wrote a blog called Staffing Partner Friend or Foe, and I've recently just published that again because I thought it was a really relevant one at the moment with everything that's going on. Obviously, we're going to recap on that. What was your, obviously, perspective of a staffing partner before you joined, and then obviously, what is it now you're with Hallam Medical?
So as I've said to you before, I had a very different idea of what a staffing partner was before I came here. Not a good experience either. I'm
Yeah,
not afraid to say. There'd be days where I'd be in charge of the trust and need some nurses. And I know I joke with you about this. I honestly felt that people had walked into Tesco's and said, anybody fancy being a nurse tonight? There didn't feel to be any thought or care put into what needed delivering to that
yeah,
service. And I often found myself having to move my permanent staff round to take into account that the person I'd asked for hadn't got the skills that I required, that I was clear about. So, and
yeah,
then I came to Hallam, and I suppose I was so impressed with the care, the thought, the education that goes on, and a real understanding that an advanced practitioner is not just one thing. They
yeah,
are so varied. What the
yeah,
service requires can be night and day. And Hallam actually, put that thought and effort into what clinician are they delivering to that service. Also thought into that clinician as well. Where do you go on your first shift? What do you need to do? Where do you park? All those bits that can be quite stressful when you're going to somewhere
yeah.
for the first time, really. And I was just so impressed that I felt there was such a dedicated, driven team to make sure they delivered the best for patients and clients and clinicians.
Yeah, 100%. And like the one word obviously that you mentioned was care. And as you know, one of that is one of our values at Hallam. And obviously we care about what we do. It's not just about placing a nurse to get the job done. It's actually about matching the skill sets, making sure the client's got the
Absolutely.
right clinician for the right job. And as you know, obviously we do have quite a big compliance process to make sure that those clinicians are compliant. At the end of the day, they're supporting that client, but they're also, imagine if that person's supporting your parent, your parent or your grandma or anything like that. You want those people. You put your trust in them. Just so I think
Exactly.
100%. I think we
And I have
do.
to say
Yeah,
that the compliance team we have are pretty amazing, actually. And
yeah,
the amount of effort and dedication that goes in to making sure that clinician is exactly what it says they are,
yeah,
and that they're up to date with the mandatory training, and DBS checks are done, and NMC checks and HCP. They
yeah.
put such time and dedication into that. And I have to say, my personal experience is you don't get that everywhere from every
No,
staffing
you
partner
don't.
at all.
That's just popped into my head. Can you describe your time at Hallam Medical in 3 words?
Oh God, my time at Hallam Medical, crazy, friendly, dedicated.
Amazing. Thank you, Lisa. Obviously, we've got some more podcasts coming up with our partners and obviously some more team members at Hallam Medical. So please stay tuned to see when they're going to happen. See you later. Bye.
Bye.